Right. Welcome, everyone. Welcome to our big kickoff of the Building Bridges project. I have a few quick housekeeping items before we get started. First of all, you're going to see a survey pop up on your screen. We're going to leave that up for a few minutes. Please take a minute or so just to review that and answer the questions. It'll help us a great deal going forward. While you're doing that, a few notes about today. We are in Zoom webinar mode. So all of our mics are on, but all of your mics are muted automatically. And we're going to leave the chat box open for everyone to talk to each other, introduce yourselves, and get moving. We will be taking questions during this webinar, but there are so many folks on the call today that we're going to ask you to use the Q&A function of Zoom only to put those questions in. So please don't put your questions in the chat box. Please use the Q&A function, which you can find by hovering down towards the bottom of your screen. You'll see a little bubble with Q&A pop up. We're probably going to hold those questions to the end, but if there are timely ones, we will jump in and ask them right away. There are no CEUs for today, but you will get an email confirming your registration. We are also recording today's session, and it will be emailed to you and available on our NCVC YouTube page. And also, this is being streamed on our Facebook Live. With that, the exciting part. Thank you so much for joining us to learn about the Building Bridges project, a collaboration between the National Center for Victims of Crime and the branches of the Southern California NAACP. We are so excited to have you. We love talking about this project. I'm Renee Williams, the Executive Director of the National Center, and I'm delighted to be joined by the presidents of the Southern California NAACP branches, Daryl Good, the president of the Santa Monica Venice NAACP, Dr. Cheyenne Bryant, the president of the San Pedro Wilmington NAACP, Ron Hassan, the president of the Beverly Hills Hollywood NAACP, and Latricia Mitchell, the president of the City of Los Angeles NAACP. We have been working together for the past 6 months putting this project together, and their partnership has been so valuable to us, as has their input and collaboration. We at NCVC have found so much strength and inspiration in this partnership. As many of you know, this week is the 40th annual National Crime Victims' Rights Week, which is very near and dear to our hearts at the National Center. Each year there is a theme for the week, and I love that this year's theme is support victims, build trust, and engage communities. This week, we seek to emphasize the importance of leveraging community support to best serve all victims of crime. We are proud to be part of this vibrant community of over 10,000 victim assistance organizations and agencies that serve survivors at local, federal, state, tribal, and national levels. I could not imagine a better time to share a project centered on that very idea of leveraging community support to help victims. I'm going to turn things over now to Richard Washington from NCVC, who is the project manager for the Building Bridges project. We'll then turn things over to Dr. Cheyenne Bryant, who will address the vital necessity of this project in our community now. We will then move on to the role of community organizations, our match campaign for this project, and next steps and how you can be involved. So with that, Richard.
Renee, before we go into the project overview, I would like to first introduce our partners from the NAACP. So we're going to give them an individual spotlight to introduce themselves and their branch, and just talk briefly about why this project would be important for their community. So to start it off, we have Mr. Daryl Good.
Good morning, everyone. Pleasure to be here. Unfortunate circumstances of violence. We reached out to victims of crime, Renee, then I had the opportunity to meet Richard. So as a result of a proposal, the branches in LA City is submitted to LAPD. As a consequence, they responded to the proposal, and we saw a weakness, and they see a weakness in their victims and crimes assistance. Therefore, we reached out to Renee, and then she reached out to the rest of the branches. And through our executive committees, we are collaborative with them to work within our community. In our branch, we are using our clinical psychologists and licensed social workers to help us. This is based on an imbalance of the LAPD has a program where they reach out to victims, even if they're shot by police. However, this is complicated when you consider some of the family members may have records. So it's a very imbalanced situation that we hope we can bring some clarity and assistance to our community. So we welcome the opportunity to work and provide a service to our community that's very needed. And I guess I'm back in the fold. I did rape crisis, sexual assault, self-defense training in Compton YWCA back in the day. So unfortunately, things haven't changed, and so we're back. Thank you.
Thank you, Daryl. Next, we have Dr. Cheyenne Bryant.
Good morning, everyone, and happy Thursday. I'm Dr. Cheyenne Bryant. I'm president of the San Pedro Wilmington NAACP, and I'm a psychology expert life coach. I am, honored to be a part of a partnership with the National Victims of Crime, to be able to collect data, to bring very much resources to a community based on the community letting us know what their needs are and not the needs that we want to provide them. That has been a big gap and a big stigma between community resources, a group of people not receiving what they need and receiving what certain folks want to give them. And so that is our goal here, and we'll get more into that during the entire presentation from the group collective. So again, welcome, and I hope you enjoy our presentation and you can empathize with us on the needs of the marginalized community and what I like to call our community, the Black community. Thank you.
Thank you, Dr. Bryant. Next, we have Ms. Latricia Mitchell.
Hello to everyone. I am Latricia Mitchell, the president of the Los Angeles NAACP. So happy to be partnering with the National Victims of Crime. And it is so needed, this project that we are working on, to let the community know that there is someone out there who will listen to their concerns. Many times people call and they do not receive a response. So we are going to try and change that, working with the other 4 branches to let people know that we do hear them and that we have the resources and that we are here to help them. Thank you. I am happy to be part of this partnership.
Thank you, Ms. Mitchell. And last but not least, Brother Ron Hassan.
Yes, thank you very much for allowing us to partner with you in this project. I'm on the national board of the NAACP, as well as an area director for 13 branches in the Southern California area. The NAACP as an organization have been working very hard to try and bring about a better working relations, more of a community-minded kind of partnership with many of our local police departments. It is a difficult task. We are very pleased that we've been able to partner with this crime victims organization to bring about statistics that we believe will help us in having those police departments understand the need for us to take a different look at what is occurring with victims and the way people of color, particularly African Americans, are being treated in America today. We hope that the results of this will help the police departments, help many members of city councils better understand the need for these programs to exist so that we can help our communities in terms of community policing. This project will last for 4 years. We're comfortable with how it's going. We thank all of the members of the Crimes for Victims organization for working with us so that we can help to make our communities safer and better. Thank you for your time. Thank you for your interest in making this project work.
Thank you so much, Ron. And as Renee stated earlier, my name is Richard Washington, and I'm a program manager with the National Center. I lead our Project Safe Neighborhoods initiative, as well as the Building Bridges project. Project Safe Neighborhoods is a Department of Justice funded strategy that combats violent crime in partnership with federal, state, local, and tribal law enforcement, prosecution, and communities across the country. The National Center leads this effort by serving as a voice for victims and by providing trauma-informed and victim-centered training for all of our PSN sites. My work managing Project Safe Neighborhoods, as well as personally advocating for victims who oftentimes do not have a voice, as well as my passion for enhancing services for historically and underserved communities is the reason why that I am so happy to have this project in place and why it's so important to me. So there is historic and deep-seated mistrust between marginalized communities, as we all know, especially the Black community. And those that work in the criminal justice system, we see that far too often those victims from those communities do not get the services or resources that they should. This project looks to identify gaps and barriers in victim services in historically marginalized communities and seeks to develop strategies to bridge those gaps. To do this, the National Center and the NAACP will collaborate with local organizations, community leaders, and crime victim survivors to establish a productive and healing dialogue about what the Black community needs from the criminal justice and victim services professionals in order to achieve effective encounters with victims of crime. Additionally, our healing dialogue will look to find out ways to begin to mend the relationship so that victims of color not only have access to these services, but feel safe doing so. So I'm going to share my screen. The Building Bridges project will be split into 3 different phases, tailored to fit the needs of the Los Angeles metro area. Phase 1 is all about planning and assessing. We cannot do the good work without understanding what the community identifies as barriers and what they really need. We will assess this through a community survey, listening sessions, roundtables, as well as town hall meetings. The survey is a community-based assessment that will ask respondents about their victimization experience and if or how they saw services for the aftermath of their victimization. We know that sharing this information can be scary and it will bring up feelings that I'm sure a lot of folks would not want to bring up, but we are going to do our best to make sure that those who are in need of services will get those services as they take that survey. In the second phase of this project, we will analyze what the community has identified as barriers to service, issues with current services, and areas for improvement. We will work with the community members to design and implement tailored training and technical assistance. This phase will be extremely important as we look to have a little bit more data-informed, culturally humble, and victim-centered training and technical assistance and resources to support this particular community serving Black victims of crime. The last phase of this project will be to evaluate what we have done in years 1 and 2. Communities of color are often tasked with being the subjects of evaluations and mainstream partnerships. We will strive to ensure that this partnership is not only equitable, but also fairly compensates those involved for their expertise and lived experiences. So yesterday I had a great experience, a great time joining a keynote speaker by the name of Louis Reed from Reform Alliance. And he quoted and stated a particular statement that I thought was really important, particularly for this project. And I wanted to share with you all. And the statement was, those closest to the problem are closest to the solution, but furthest from the resources and the power. And I'm gonna say yesterday, he stated it twice so that everyone can hear him from the back. Those closest to the problem are closest to the solution, but furthest from the resources and the power. And this is exactly why throughout all 3 phases of this project, we will continue to demonstrate the importance of community engagement, reinvestment into communities of color, and the development of community partnerships, and how this will impact the victim services field. The next 3 months of this project will be really important as we continue engaging the community, which we cannot do without you all in this call as leaders in your community. As gatekeepers, we know that you have insight and wisdom and can engage the people you come in contact with. Our main goal during this time is to spread the word about this project and begin our initial data gathering, which will be through our community assessment. We will be sharing more information as well as different marketing tools in the next few months that will assist us in this effort. This of course, is a true community effort, and we need everyone in this call to assist in that. We can all play our part in affecting changes we want to see in our community, specifically the Los Angeles community. When we begin to build bridges between the justice system and victims of crime, between the Black community and victim service professionals, we strengthen the community. We make it safer, we make it equitable for all victims of crime. I would now like to turn over the floor to Dr. Cheyenne Bryant, and she will talk a little bit more about some of the services in need for the Black community, as well as explain how and why this project will be important for Los Angeles.
Richard, thank you. Before I get into some stats and just share some information, Richard's going to just play a video that sums up something in real life so that you guys can get the experience from from the perspective of the actual individual, a Black male who has undergone a lot of trauma, and he happens to be in the community that is marginalized. And so you can get a real life experience, which is what we plan to do when we collect our data and we collect what it is that the community needs. So thank you, Richard.
Breaking generational cycles. I'm Taylor Torgano in Los Angeles with how one life coach and psychology expert is tackling the issue of mental health in the Black community. You can see it in his eyes. It's taken a lot of pain in nearly 30 years for Quentin Raffels to reach breakthroughs like these. He says he has his life coach and psychology expert, Dr. Cheyenne Bryant, to thank.
The tears are really a sigh of relief. It's a thank you. It's wow, we are accepted.
It's the progress Dr. Bryant strives for as a mental health advocate in the Black community. She says it's a simple lesson that she teaches clients often. Continue to be who you are and stand in that power.
And all I'm doing is shining the light on what he couldn't see. It's like an eclipse. I always say, we are this moon who's perfect and beautiful. And then life and trauma and that learned behavior that's dysfunctional comes in and it eclipses us.
Yep.
But when we get awareness and we get love and healing, look what happens.
This is the first time she's able to meet with Quentin after a year of coaching him virtually. He says she's changed his life as a Black man who grew up suppressing his emotions in a toxic and violent household.
I was not raised in an environment that encouraged therapy, that encouraged talking to people about your problems. It was quite the opposite. I grew up in a household that, really championed you based off the type of the level of pain in which you were able to hone in and hold.
A pain passed on for generations. Quentin's dad was addicted to drugs, physically and verbally abusive. Quentin didn't have a role model to emulate. As a child, he never got the embrace he craved so deeply from his father.
I've dealt with not just abandonment issues, right, and not having my father actively displaying and modeling what a man is supposed to be, how a Black man is supposed to hold and maintain self-control when he's angry, how to express yourself if you're sad. I grew up in a household to where I was literally not allowed to hug my father.
Now, Quentin's a father of 3.
That's my queen.
And on a self-discovery journey to break the cycle, intentional about healing from the same pain that his father projected onto him. Dr. Bryant says the Black community is filled with Quentins.
Walking around with symptoms of depression without the awareness. You know why? Because there's 13.3% Black folks in the United States of America. 11% of them do not have access to health care.
But even those that do often don't seek help. Quentin says he's grateful to be learning that the real strength lies in his ability to lean on others when life just gets too heavy to carry.
And for me, that's what the journey is all about at this level. And ultimately, I feel like I'm just getting started.
Teaching the Black community how to repurpose the tools they already have, like using a hammer to build instead of destroy.
Awesome. All right. Thank you, Richard. Thank you so much. So it was really important for us to show that video in the sense that everything that the gentleman Quentin on there was referring to was culture competence, right? And so when you're dealing with different organizations or different fields, whether it be the mental health field, whether it be the law enforcement field, or even folks who are different, different platforms and places to be able to provide assistance or provide resources or help, if they don't have the cultural competence behind it, then they're doing a disservice to the community that they are serving, right? And so I just want to give you some stats, which I said on the video, but it's 13.4% population are African Americans, okay? 16% of that 13.4% have reported a mental illness. That's 7 million African Americans in the United States. All right, you can go on to the next slide, Richard. What that means is that we have African Americans who are in marginalized environments and communities, right? And oftentimes in homes, as Quentin, the guy from the video, very easily articulated, they're under distress. They are in places where they are merely surviving and not able to thrive. And then you have law enforcement, or you have folks even in the mental health field, or you have people in other positions who are attempting to provide help, and some who are not, coming in trying to give them what they believe it is that they need. And oftentimes when data is collected, African American population is either not included in the data, or when they are included in the data, that data is not used to benefit them and their community. That data is not used to give them what it is that they need. It's often used to be able to create bigger budgets, to keep those budgets circulating in the same hands within the same people, benefiting everyone but our community, okay? And so Black people living below poverty level are twice as likely to report serious psychological distress, right, than those living over the 2 times of the poverty level. What does that mean? That means that our folks who are in these communities, and particularly inner cities and different communities where resources are not available, right? They are also in environments that are not only traumatizing them, but re-traumatizing them. And so what do you have? You have somebody who is already under distress, who is now experiencing more distress. And what does that person do? Let me ask you guys this. What trauma is ugly, okay? What does a person or individual who is experiencing trauma look like or do? They are frustrated, they are angry, and they're exhibiting behaviors that don't look like the population that's outside of our inner city, outside of our community. Again, that goes back to a cultural competent issue. Another thing, African American adults are more likely to have feelings of sadness, hopelessness, and worthlessness than other white adults. Well, if we're not getting the resources, if we're not getting the support that's needed, then obviously we don't have feelings of hope. We don't have the feelings of empowerment. We can't come out and really be our full potential. That doesn't happen under certain issues. Another thing is, you know, if you have a field such as my field, the mental health field, where it is Caucasian driven. Our tests are Caucasian driven. Again, the data found is Caucasian driven. How does that help a marginalized community? How does that help when you are treating an African American, male or female, who comes in your office? It doesn't help. It does a disservice. That means that we end up being under or overtreated, under or over medicated. Either way, it's a disservice, and it causes more impairment to begin with than the issues or impairments that this individual came in. And I always say that there's a difference between diagnosis and symptoms. If somebody is having a bad day, a bad week, or possibly even a bad month, it doesn't mean that that individual is diagnosed as any mental health illness. That is a big stigma in our Black community. Folks can feel sad, can feel hopelessness, can have certain symptoms and not be diagnosed as that illness. That is something else that is happening extremely out of control when it comes to our diagnosis, to the folks who are able to get the resources they're providing are causing more impairment. African Americans make up, again, I said that 13% of the population, right? 40% of the prison population. What does that mean? That means that we are underrepresented when it comes to resources, underrepresented when it comes to healthcare, mental health treatment, but we are overrepresented when it comes to our prison system. Okay, that leads me to my next fact, that African American people who have mental health conditions are more likely to be in jail or prison than other races. So what does that tell us? That tells us that resources are key. That tells us that when you provide the effective resources that a community needs based on collecting data and information with cultural competence from that community, that you can provide them efficacy and effective resources that will change the trajectory of their life, their families' lives, and their community. That means that the data that we are collecting, that means that the work that we intend on doing should, with the right resources, be able to keep our African-American men out of the prison system where we are overrepresented and in their homes with their family where they belong. You can go on to the next slide, Richard. Okay. Another thing is we in our community, we're less likely to receive guideline consistent care. What that means is studies show that whenever, African Americans experience anything that has to do with a mental health distress, a mental health illness, we go to the emergency room. We're not going to a mental health professional. So we go to the emergency room. And when we go to the emergency room, what do? We get care for that moment, but we're not following up, nor do we get the referral to the proper resource or the proper expert or proper professional that's needed for that at which we are experiencing. So that means that our care is it's inconsistent. So what happens is we end up leaving again with a healthcare disparity, with receiving a resource and receiving a care that doesn't allow us the longevity of having a healthy, stable mindset, a healthy, stable environment, and obviously that affects everything else around us. And we're less frequently to be included in the research. And I stated that earlier. Not only are we less frequently to be included within the research, but when we are included within the research, we're usually used as a census to be able to obtain more funding or budgets for whatever it is that particular program or organization is creating. And guess what? We end up not receiving that resource that we were included in to obtain the funding and resource for. Correct? So more likely, like I said earlier, to use emergency rooms for primary care than using mental health specialists or even primary care doctors. Go ahead, Richard. There you go. So what are the benefits of our project? I think I pretty much covered most of what the benefits are, but just to go through them again, it allows us to gather data on a marginalized community, on the Black community. The data allows us to provide necessary care and resources to the Black community that obviously the resources that have been provided, they're not effective. I'm not saying none of them are effective. What I am saying is that whatever is effective isn't effective enough for us to be able to pull us up from the marginalized disparities, the healthcare disparities, everything else that's going on. And then our intent is to create an effective support system that empowers the Black community to be able to understand that the resources available, right, are resources that they need, that are resources that are going to catapult them, that are resources that are going to allow them what is a human right to live a good quality of life. Okay. And again, the bigger picture is what this will allow our community to thrive and not merely survive. And a lot of this obviously is systemic. And so because it is systemic, we can't allow the folks who have already broken the system, or the folks who either are aware or unaware that they are systemically rooted in the issue, be the decision makers on what this community needs, when the community should be the ones who are able to do questionnaires, have open dialogue, have a days of dialogue type of community interaction where they're expressing what they've been through, what their trauma is, and what they need as a community and as a people and as a culture. So thank you so much for allowing me to present. Thank you so much for listening to me. And Richard, it's back to you.
Thank you, Dr. Bryant. I will now turn this over to Rachel Gibson from the National Center, and she will facilitate our Q&A section.
Wonderful. Thank you, Richard. And we had a few really good questions. The first question we had was, sorry, I'm scrolling through. This person stated that they love the idea of creating healing opportunities for people of color who may not have had service. But what about the systemic issues of racism that they encounter regularly? How will the project address the systems?
I can answer that question, and anyone else can hop in. So that's going to be extremely important to know and understand in year 2 specifically. That's when we are going to go to the criminal justice actors in the Los Angeles community and take the data that we got from year 1 and take the experiences and let them hear the dialogue from survivors and victims from communities of color so they can hear it themselves. I think oftentimes organizations, we like to be the voice, you know, and sometimes that's helpful. But I think this project is going to be extremely important for those criminal justice actors to hear their experiences from their mouths. So we're going to take everything that we do gather from year 1, and this is all things that we will share with, you know, the Los Angeles Police Department or other criminal justice actors in that community, to make sure that they are aware of what's going on and to make sure that we can address and see how we move forward from there.
Yeah, and Richard, go ahead.
Richard, Ron Haston. Richard, can you hear me?
Yes, Ron.
Yes,
please.
I can hear you.
Yeah. I think also that we want to make this lady aware of the other parts of the project in which we have indicated that we believe that the police departments in the Los Angeles areas are operating with 1990 data. We're living in 2020. Things like climate sensing, things like recruitment, other aspects of what police departments do, we believe they're outdated. The Los Angeles area went through a consent decree, which lasted for 10 years. Once it was completed, we found that even during the consent decree and after the consent decree, we're dealing with some of the same issues over and over and over again. We feel that it is necessary for the police department to update their activity to become more community-minded and oriented. And we believe that through utilizing the services that your organization has to give us in terms of giving them statistics to show what is missing, where there's a need to update and become more effective and more community-minded, that's the approach that we have to do. We can no longer just go and talk to them from a gut level. We have to begin to talk to them with statistics and information, which helps them to understand that they can no longer police our communities with outdated information, with outdated action items.
You know, to the point of the question, this is to Daryl Goots, I'm Micah Venice. This is not a panacea for the devastation that faces the African-American community. It is specific in terms of victims of crimes, and hopefully maybe this data will lead us to more roots of what has to be addressed, but it wasn't our understanding that this would help mitigate all the things that we face, but it would take care of a vulnerable population, as Richard said earlier, those who are farthest away from the solution, to give them some hope and maybe some intervention strategies with police departments and in city services in general.
Wonderful. Thank you all so much for those thoughtful answers. We had one more question I saw come through in our Q&A. Do we have any programs or projects geared toward prevention or proactively engaging the youth? For example, there's a camp for sale called the Oaks. Would we consider purchasing and using this for the youth and family programs?
Richard, there is a program in the Los Angeles area which brought youth to the police departments, and the police were utilizing youth as in ride-alongs and other kinds of activities to help them understand the roles of police departments. There was a program that the Los Angeles Police Department had called DARE, and that was utilized. Like all of the other activities that go on in police departments, it really needs to be updated. It needs to be brought to a 21st century, 20th century kinds of awareness, and help youth get involved with activities that's going to help them to become more friendly. Community policing is a need, and it should be addressed with youth camps, youth activities, youth softball leagues, baseball leagues, and of course, summer training programs. So yes, there are some, but not enough.
Again, this is Daryl Guth. It's not in the scope of this project, although it sounds like a great opportunity for another venue, but the scope of this project is slightly different. But the suggestion is well taken.
And I think that's an important idea and an important statement to keep in mind as we are assessing the community and figuring out what the needs are in the next year. I think one of the biggest ways that we could work to prevent things from happening is to make sure that youth, they're getting the services and the resources that they need when things are happening to them. And I think in a victim-centered framework, too often times we have victims who are youth and from communities of color, one, they might not even know or be aware of the fact that they have been victimized. And then two, taking an additional step up and then finding resources or services to fit that victimization, it's sometimes often unheard of. So I am literally jotting that thought down. I think it's something important that we need to think about, to keep it in the victim-centered framework, but to also go to the T of preventing additional things from happening.
Totally. And Richard, I just want to add that the resources that are provided, if they're not going to be provided by somebody who looks like us, it needs to be provided by somebody who understands our culture. And so this is not a racial thing, it's a culture thing. I say that because trauma looks different on everybody. Trauma looks very different on our culture and on our people. And I believe that because trauma does look different on us, that is a lot of what the gap of what's going on the streets and with law enforcement. You have law enforcement that doesn't have the competence of culture, of our culture in particular. They don't understand that, again, frustration, right? And that as a part of our trauma, anger looks a certain way because we are a traumatized community. And so when we are boisterous or we act out in a certain way, it can be a threat to those who don't understand our culture. And it can be something that is empathized with if you do understand this person is distressed, this person is under trauma, and this is a traumatic behavior, and this is what it looks like. And so I need to address it or handle it in this way. And I say that because also in my field, the mental health field, one of the biggest factors of African Americans not receiving help is because there's only 4% of African Americans in the mental health field. And so that means that 9 times out of 10, when they go get care, they're not getting care from somebody who understands them and allows them the privilege, and not privilege, but a human right to be authentic in who they are and what they're going through. And again, we are treating, right? We are treating trauma. We're not treating the person. We are treating trauma. We're not treating the person. Meaning, if you detach trauma from the person, it will allow you to have compassion and not judgment toward what they're doing and how they are behaving. That is very important, because when you see from the eyes of judgment, then judgment is what? It comes with punitive punishment. It comes with punitive consequences. When you are helping somebody, you're not there to consequence them. You are there to support, provide resources, and facilitate them so that they can come out of that space of trauma and really come to the fullness of who they are. And so I just wanted to add that, because I believe that it's a big issue in our community, that we are underrepresented in a lot of the areas where we need the resource. And so that becomes an issue. Thank you.
Thank you so much, everyone, for your responses. We had another question that I think is a good one to pose, and it's, how can a police department be more community-minded and work with the community if the community continues to devalue the police and not want to work with them? This person said they keep hearing people in certain communities of color say that they don't want to work with police or want their kids to be police. So how do we get past that?
And I think that's where our community partners, that's where they come into play, because the community's partners are the leaders in the community. They are the ones who have direct contact with victims and survivors from the communities of color, specifically in Los Angeles. So when we are talking about and referring them to services, we have to keep in mind that there is a barrier there because of mistrust, historical mistrust. So we have to first understand where it's coming from, but also know that we have to go and route things a little bit differently to make sure that they may feel a little bit more comfortable to talk to the police. I think that's why it's going to be extremely important for us to have dialogue and for us to be able to sit down with victims and survivors with law enforcement officers or other criminal justice actors to be able to voice their experiences, because oftentimes they don't have that platform to do so. And once someone can, voice what's going on and what's gone on and how it has affected their life, I think they'll be a little bit more forthcoming as far as working with other criminal justice actors or professionals in the field. Now,
let me speak to this,
open that
Mr.
up for
Borson.
anybody else.
Let me speak to this for LAPD, Los Angeles, the city of Los Angeles. And it's not only historical, but they continue to create, by their actions, continue continue this current in the community. And they're in organizations like the NAACP and others, we're in this collaboration to be an advocate for the community. And until the LAPD gets on page and controlling their rank and file, we've got to address it for what it is. And until that distrust, we met with the police chief the other day, and initially we brought up about a little over a year ago, finally they convicted a police officer for brutally beating a Latino 21-year-old young man. But it took forever. And that beating was captured. And so this distrust and on the command level, we have an operational relationship, but within the community is still a challenge. And I fully understand people who do not want to work with them, especially families and individuals who have been victimized by them. But that's our role, to be the advocates and push back when we have to push back to the city or LAPD in advocating for African Americans and other people of color.
Wonderful. Thank you very much. So we had a couple of questions that I'm going to group together. While I'm reading the second question, I'm going to ask Richard, if you could please pull up the slide that outlined the phases of the project. We had a couple of folks wanting to see that again. So if you can get that up, thank you. And then we had a lot of folks interested in the survey that will be distributed. One person asked, will the data gathered by this project include breakdowns by age and other factors? For instance, the underreporting of elder abuse is universal, but there may be additional barriers within marginalized communities of color that results in even greater underreporting.
So yeah, there will be quite a few different demographic questions that will ask about age and ask about sex and ask about ethnicities. And using that data, we will be able to kind of put together stats and information as far as specific groups or ages and see how crime has affected them and their victimization. So yeah, the assessment will include some demographics so that we can get that sort of information in the future. So that was a really good question, and I hope I answered it.
Wonderful, thank you. Another really good question along the lines of our last law enforcement one. What other options will be provided to victims other than going to law enforcement? That option is not desired by many of the crime victims, not just because of distrust, but because they do not want to pursue a carceral approach to violence or abuse. So what are some of those alternatives that people could seek out?
It's another really important question. And that's also in the realm of bringing awareness to the field. And I think a lot of the times when we think of victimization, we automatically assume that it has something to do with the police, something to do with reporting your crime to law enforcement. But there are so many different organizations in everyone's community, specifically the Los Angeles community, that will provide services to victims of crime without a police report. And so part of our job for this project will be to bring those organizations together and bring awareness to the services that they provide and how someone can contact them. And I think that's really, really important, because we do have that mindset, oh, I have to call the police in order for me to get this help. But that's not always, that's not a route that you always have to go. There are a lot of organizations out there who will provide the same services, the same resources, without you having to go into a law enforcement agency and report your crime. So we are going to be working with community organizations to get more word out there about the great work that they're doing. And I think that will be such a huge relief to the community to know that there are organizations out there who can support them in their feelings, in their experiences.
Richard, this is Ron Hassan. This begs the question, at some point in time, would we expand our range of being able to provide awareness and assistance to the community? The program that we're looking at now covers an aspect of what the community feels is needed. But certainly, I think our survey and other information that we're going to get is going to show that there's a much greater need in the community that goes far beyond what we're looking at here. Each step that we take in partnering with agencies and groups like yours and other groups as we continue to move forward, we believe that these are the steps that are needed to make our community safer, and help the police to understand that community policing entails a lot of activities. And our goal is to try and fill the gap on as many of those activities as we can.
And Richard, in the chat, because I'm in there chatting with our attendees as well, someone brought up a really, really good point, addressing secondhand trauma in the police force. I'm gathering that is pertaining to our Black officers who are having to deal with being Black, right? That trauma, and also being an officer. And I think they were asking if that is something also we're going to look into and address. And I don't know if, Richard, you wanted to answer that, but I wanted to say that I think that is a great idea, because when we say our people, that is not just pertaining to the Black community folks who are on the street. That's also pertaining to Black folks who are in organizations providing resources, Black police officers, law enforcement. They also are at the hands of the trauma, and they also are ones that need resources as well. And I think that would be a good angle. But go ahead, Richard, if you have something to add.
I think that's a really good point. And vicarious trauma is something that could really deplete someone's not only their self-esteem, their work ethic, but oftentimes it may make you feel like you don't even want to do the work anymore. And so we at the National Center for Victims of Crime have coordinated several vicarious trauma trainings across the country. And I think it's going to be important as we move into year 2 and 3 to make sure that we involve those sort of trainings for law enforcement members of color to make sure that they know that we know that it's not easy to be in that place, to have to divide yourself between being a person of color and then also being a law enforcement officer. And I appreciate that comment, because I don't think we think about that as much as we should. So that's again, a really good question. And that's something that we will be looking to do. And hopefully the Los Angeles Police Department is open to that sort of suggestion, but I think it's going to be really important. And we have done that in the past.
This is Daryl Good again, within the scope of what we're doing, the NAACP, we're addressing that on another level with law enforcement. I'm in contact with police chiefs, assistant chiefs in the county and outside, and most of them are African American, and I don't know any of them that have experienced some abuse by law enforcement officers that were not Black. And when I asked them, have you ever had issues with Black officers, the universal answer was no. So this is a really critical and kind of separate issue that it's going to be a fight that we're going to have to push on another level, because I don't know if you saw what happened in Tennessee. It's like they didn't even know about George Floyd. So we got a lot of things to do on in a larger issue and take on LAPD and their treatment of the African-American community.
Now, just one more point to wrap that up. And I'm just thinking about that question again, because I think we have to remember that even though it's trauma within the law enforcement officer, that trauma can kind of push them in a way to not be able to serve our community the way that we would like them to serve the community. So if we're making sure that they are, learning about vicarious trauma, and they're also getting services for mental health as they are going through abuse in the agency or so forth, that would be another way for them to be able to do their job a little bit better. So when they're not having to always thinking about that consistent trauma, when they're not always going through that or have that at the back of their mind, they're going to be able to they're going to be able to police our communities a lot better, I think. So I appreciate that, Mr. Darrell, and that was again a really, really good question. That's something that our partners will take back and discuss amongst each other. So.
Wonderful. And I know we're down to our last 5 minutes. We did have one question, and I think it would be helpful for everyone to hear for a clarification. For Dr. Bryant, I know you mentioned about trauma can be seen as a threat. Can you kind of reiterate what you were saying there? I think some people may not have heard your full answer, but we would love to kind of get more understanding of what you were articulating there.
Absolutely. Perfect example is, I don't know if you haven't seen, I'll just say a few months back, there was a white guy who had a knife and he was running at the police and he's chasing the police down. He turns around and starts to run, and the officer starts to chase him. The officer gets on his call and he says, "Hey, white male, he's under distress. He has a knife. I need backup." Chase the white guy down, finally got him, got the knife out of his hand, and did their arrest. Keyword, white male under distress. So they associate that behavior in the Caucasian male environment, Caucasian male world, as being distressed. They look at a Black man with a knife running toward the police, away from the police, as a threat. That is a cultural competent issue, because in our culture, and let me be transparent, in my household, my father can get very passionate when I was a teenage girl and fuss at me in ways that roared up some bass in his voice, okay? And there's a way that he said things that he didn't have to do anything but say it to me, and I understood what he meant. That right there, the roar up of our culture, the way that we approach things within our household, we understand that's not a threat. But if we take our household culture, our household dynamic, and we put that on the streets in front of law enforcement, okay, it looks differently to them. The second point to that is, and I said this, Darrell, and you guys were there in the meeting with LAPD and the chief, that you can't ask a community that's not professionally trained, because not everybody in our Black community is a professional, correct? Who's not professionally trained as an officer, as a professional, whatever that may look like, to act a certain way that we should be able to expect our law enforcers who are trained professionals and there to serve our community. They are expected to act as professionals, and they are expected to have a competence and an awareness of what that looks like. But when you are pulling over somebody, a group of Black boys, Black men in a car, and they are afraid for their life because they have been re-traumatized by an ongoing media that they've seen all their life, I'm sure, about how a Black man, Black boy gets treated, they are going to exhibit behaviors that look like fear, which turns into fight or flight. And if you don't understand that background, if you don't understand that competence of our culture, you will be imposed as though you are threatened. And if you understood the background to that, the trauma and re-traumatization that happens every day, all day long, then you will be able to do, like I've seen very few officers do, you will be able to talk that individual out of their flight or fight. You'll be able to explain and have compassion for why it is that that individual is feeling the way they feel and exhibiting it the way that they do. The last point is, when you come from an environment that is called the inner city or marginalized, it's called that for a reason. When you walk out of your house as a young boy or even an older man or even a woman, there is a certain level of threat that becomes your normalcy. And you learn how to protect and survive that environment, not thrive in that environment. And so when you pull me over, even as a woman, okay, and possibly a professional, and you're pulling me over and you're a white cop with the badge that looks similar to the guy I see on the television that continues to re-traumatize me, and you pull me over, I'm still in survival mode. And so that looks different on me. And my survival mode is going to be a defensive mechanism to protect myself, even if it's subconsciously and I'm not aware. Cultural competence is something that is needed because, again, we're looked at as a threat and then we're treated as a threat. And that's what I mean. I hope that I was able to give good examples of that. Hope that answers the question, Rachel.
Yes, that was so powerful, and thank you for that. I think that's a wonderful way to end the conversation. I appreciate your wisdom and expertise on that topic. I'm going to go ahead and turn it back over to our Executive Director at the National Center for Victims of Crime, Renee Williams, to wrap us up. Thank you.
Thanks, everyone. So I think everyone, I'm watching the comments, I'm watching the Q&As, and I know everybody gets why this is so important right now. And there were a lot of questions about how can you get involved, who else is being involved, and how do we move this forward? We do have fundraising. Those fundraising efforts are shaped largely in part by contribution of NCVC's founder, Ala Isham. She has pledged up to $109,000 a match in the first year, and we're putting everything on there to support the project, how you can support the project. One important thing that I want to note is we know that this is needed in other areas. It was a discussion that we had from the very beginning. This is only meant to be a pilot project. We hope that best practices come out of this and that we can absolutely extend it to, well, I mean, we'd love to go national with it and extend it to every police department in the nation, and all communities in the nation. So if you would like to find out more, you can find out more about the campaign. We have a multi-level approach to this. You can also consider becoming a member of NCVC, and we will keep you informed as we move along. We want to thank everyone for calling in today, and especially thank all of our presenters, both for their support, for their partnership, and for joining us and giving such amazing insight. Thank you so much.